Is sponsored by
Schools are back in session, and during this busy time of year, when you're thinking of setting up back-to-school appointments for your children, remember to add a visit to the dentist to your list. Our guests today are here to remind us why taking care of their teeth can help ensure a great school year for your children. Elaine Loyak from Delta Dental of North Carolina and Heather Cook with the NC Division of Public Health are here to tell us all about it. Thank you for being here.
Thank you. Thanks for having us, Trent. I'm going to start out with a number for you.
Okay.
51 million.
What is that?
According to the American Dental Association, an estimated 51 million school hours are lost every year in the United States due to dental-related illness.
Elaine, that is staggering.
It is. And I'm going to share a story that helps illustrate that. But first, you and I have talked before about our foundation's Smiles for Kids program.
It's amazing.
Yes, thank you. And the founding of it was rooted in Delta Dental of North Carolina's belief that everyone deserves a healthy smile, and our mission to improve the oral health and the overall well-being of the communities we serve. While visiting one of our Smiles for Kids grantees, the Orange County Dental Clinic, we had a mother share a story about her daughter who had been a straight-A student but then started having failing grades. And what they discovered was she was in pain. She had dental pain, and they took her to the Orange County Dental Clinic, who helped heal her.
Yes.
And once she was back in school feeling better, then her grades started to rise again.
There we go, back to straight A's.
Exactly. So I'm glad Heather can be here with us today, because in what she's going to share, you'll gain some insight into what was going on with that child and why the change in her grades, as well as how we can all keep ourselves and our mouths healthy.
Yes. Well, Heather, let's bring you in. Why is it just so important to tackle those healthy habits at a young age?
So like Elaine said, pain from dental decay and other oral health issues, they can distract children from learning. It makes it harder for them to focus. Also, children with poor oral health are, like you said, obviously more likely to miss more days of school every year.
Yeah. Oh my gosh. So it's so important to really tackle it from the get-go. Now, what does this represent before us, this Rethink Your Drink display?
Well, I'll tell you about the display and then leave it to Heather to tell you why it's so bad. So this really is to show people, to illustrate the amount of sugar in a lot of the popular drinks that we consume. And our message today is not, or our message in general with this display is not to say don't drink them.
Okay.
But to hopefully choose water more often, or if you are drinking these drinks, take a sip of water every now and then to help wash that sugar off. So you'll see in our little bottles, there is no sugar in the water container, and the sugar amounts increase as you go up. Our showstopper is the Mountain Dew with 19.
Elaine, that's a showstopper, all right. You were saying steadily increases. Of course, water's the ultimate option. But when you get to that sugary Mountain Dew, what?
19 teaspoons of sugar.
That is startling, just like your statistic off the top. Now, Heather, tell me a little bit about what we can do to combat this and have better habits.
Yeah, so there's a couple things. Making sure that you're brushing your teeth at least twice a day, visiting the dentist at least one time a year. You can ask your dental provider about dental sealants, which help prevent dental decay. Also, when you're brushing, you want to make sure that you are using a fluoridated toothpaste, and there's some cute little sayings to help you remember the correct amount. So for children ages 0 to 3, so from the time they get their first tooth until they're 3 years old, the saying is a dab will do, and that's just a little dab of toothpaste about the size of like a grain of rice. That's all they need.
Just a little bit will go a long way.
A little bit. And then for ages 3 and up, even to our age and older, you can do a pea for me, and really all you need is a pea-sized amount of toothpaste.
Those are great little sayings.
It is, and it's, you know, they rhyme and they help you remember. And then also just trying to limit the amount of sugary drinks that you have.
Limit that intake.
Sugar drinks, sugar treats, like Elaine said, not that you can't have it all the time, but if you're going to have it, try to limit how often you have it.
Just cut back a little bit, and then of course, like you said, brush twice a day, remember your flossing, and a regular dental visit.
That's right.
I love it. Elaine will tell us where we can go for more information about this and all you do.
You can visit deltadentalinc.com.
And before we go, there is such an awesome school program that you guys do. Tell me about that, Heather.
Yeah, so as a North Carolina Oral Health Section Public Health Dental Hygienist, one of our programs is the School Oral Health Program, where we go into schools, we're able to set up for the week and place dental sealants on the children's teeth. The dental sealant is just a little white coating. It's the same color as your tooth. It goes on the back surfaces of your teeth and helps prevent that child from getting dental decay. And then sometimes, it's a really good program because the school setting is the only place that children will have access to dental care sometimes.
They're in need, and you go to them to meet it. Thank you both so much.
Thank you.
Thank you, Trent.
The preceding was sponsored by